Welcome back. Your doctor wants you to stop taking so many medications. Healthcare providers are now trying to de-prescribe in order to help adults cut out ineffective medicines and avoid risky combinations. Studies show that nearly 40% of patients in their 60s take more than 5 medications at once. Joining us right now is family physician and assistant professor at Rowan University, Dr. Jennifer Caudle. Good to see you, Jennifer, and to be here. Conversation as well. Thank you so much for joining us. So, talk to us about the state of play right now. Are people taking too many prescription drugs?
I think sometimes that actually might be the case. You know, really what the issue is taking the appropriate meds. The issue with de-prescribing and over-prescribing is, as physicians, we only want patients to be only on the medications they need and no more. And the real reason is because there can be side effects with medications and there can be drug-drug interactions. So I don't want you, as a family doctor, I don't want you taking more than you actually need.
So what should patients be asking their doctor when it comes to medications?
Right. So I think the first question you should be asking your doctor, and by the way, your doctor should be going over all of your medications with you every time you come into the office. That's all your specialists, by the way. But you should be asking, do I need all of these medications? Do I actually need all of these, to make sure that you're going through each medication with your doctor and seeing if that's the case. And the second question I would ask is, are there better alternatives to what I'm actually taking? Because, with certain classes of medications, sleep meds, and other things, pain medications, etc., over the years we've developed newer formulations that sometimes are safer, are better, have a better side effect profile. So asking, is there something better I should be on, I think is important.
Yeah, and I think too, you kind of don't want to take a medication until you're suffering, right?
Well,
until there's a really clear negative impact, right? It's not like just a cure-all and you just throw some pills on it and things go away. Or like sleep hygiene, you brought up sleep medications.
Right.
There are other things to try first, but then if you need it, you need it.
That's exactly right. Which comes down to taking things only if you need it.
Yeah.
Right. So healthcare costs at large U.S. businesses expected to rise 6% in 2017. These costs just keep going up. Employers are shifting some of the burden to workers, obviously. I mean, they're asking workers to take part in cost-cutting drug programs and like Skype-like video consultation, so you can actually do a consultation with a doctor on Skype. Is that a good idea?
So Skype video calls and telemedicine and things like this, we were just talking about this. I actually think that in some ways this is going to be the wave of the future. As a family physician who sees patients almost every day in the office, it has me a little worried. I mean, there are limitations to this type of medicine practicing. It's not for emergencies. I would say if people have really major severe medical issues, this may not be the route to go. So I think there is a use for telemedicine and distance medicine, but it's got to be for the right patient, for the right situation, the right sort of instance.
Yeah.
Families today cannot afford the cost.
Yeah. Right. No, that's a very good point. And when we were talking just offline a little bit about the Skype or, that telemedicine you were calling it, I think sometimes there's a rash or there's a close-up, you could do that, but we were also talking about antibiotics, and you can't, without getting a culture, without going to the office and culturing it, you risk increasing resistance to antibiotics that weren't the proper antibiotic for the bacteria.
Right.
So.
No, it's really important. A lot of my patients actually are talking about the increased healthcare costs. I have patients saying, hey, look, doc, if I get this test, it's actually going to cost me this much out of pocket. Or are there generics or cheaper drugs? So patients are very much seeing, feeling this, where drug costs and insurance costs are rising. So this is definitely an issue.
I know you said earlier that the first question when you go to your doctor is what are you taking right now? But why so many drugs as you're getting older, and is there a big risk to taking 5 prescription medications at once?
Well, I would say if you need all 5 of them, then yes. Well, first of all, I should say there are potential risks to anything that we take. That is just a fact. But this is where we say risk versus benefit. If you've had a stroke, a heart attack, and other major medical conditions, those 5 drugs absolutely might be life-saving compared to the potential downside.
Okay.
So we want you to be on those medications. It's not the number, it's the appropriateness. If you need to be on 10 drugs, but those are the drugs you need to be on to save your life, then that's what I want you to be on.
Right.
But that's the question, is do you need to be on them?
Sure. Dr. Caudle, good to see you.
It's good to see you.
Thank you so much for joining us.